So this is the difficult question to resolve because first of all, we should have to define what a neonatology is today. And secondly, then we can talk about the role of the neonatologist. So we have a very classical view about what is the neonatologist, what is doing the neonatologist. For a classical view, this classical view is to take care and protect normal newborns and the sick newborns. And this is a very classical view of this profession. So we are pediatricians that we are taking care and protecting normal and sick newborns. But also we have an important role in studying diagnosis and treating those babies before delivery. So what we call the in utero care or prenatal care. And even more, from the last few years, we have more and more survival babies with some kind of chronic problems. So the follow-up and the care of this chronically ill patient is also a very important role for the neonatologist. So we have increasing the role of the neonatologist, not only to taking care of those babies sick, those babies who were sick, and those babies who are going to be sick in the next few months, why not, or even years. So the follow-up process is also a very important thing that the neonatologist has to be involved with many other pediatricians and with many other clinicians. And we know that the only way to improve the way we are doing our job is to know exactly how those babies are going to be. Just to know we have to modify what we are doing and we have to do something different. Because the only way to know if what we are doing today is good is to know how our babies are doing after therapy. And the most important evolution from the last few years, and this is my point of view, is that neonatologists are today more focused on the family. Why is that? Because the entire family is the important point for us as neonatologists. We are not only taking care of the baby, we are taking care of a baby in a family. And the family, the entire family must be treated by the neonatologist too. So the field of the neonatology is increasing and increasing by the last few years, taking this family account. Also, I think, and this has been an important role many years ago, but still today is important and it's going to be more and more, is that we have to be learning people and teaching people lifelong. And it's important to be learners of the job we are doing, learners of the consequences of the job we are doing, and learners of the change in the medical approach of our patient, just to modify and change, have the possibility to modify what we are doing. And teachers. And we have to teach patients, and we have to teach families, and we have to teach all the society about the risk of this population that we are facing every day. And this is a responsibility of the neonatologists. And we can't forget about the possibility that also we have to do a lot of job in research and training. Research, because this is our responsibility. We have to investigate new approaches, new consequences of therapies, and new possibilities to modify things just to improve the quality of life of our patient. And also to prove any therapy advances without the fear that we have to modify our mentalities and we have to change. We should have to be as much of humility to modify these things. And we have to provide a lot of training to our new fellows in neonatology. We have to teach them and introduce in this new philosophy of the inter-family therapy. So today, I think, and this is like a final summary of what is my view of the neonatologist, we have to be involved in a more improving the excellence, improving the quality of care, improving the quality of life, not only for the baby, but for the entire family, and of course for the society. Thank you.